name is Sam Kippen and my student number is T00698764. I'm going to be using Hunter to explain skeletal anatomy, and we're going to be starting with the skull. So we'll start with the most rostral portion of the skull, which is going to contain his nasal bones. His nasal bones will have his nasal turbinates. His nasal turbinates, it will be behind his nares and his nasal cartilage here, and the nasal turbinates will have cilia and mucus in them. The cilia will help to filter particles that are entering the nose, and the mucus membranes that secrete the mucus will help to keep the area nice and moist, which will help him with breathing, as it's easier for him to breathe if the area is moist and warm. Moving rostrally to the nasal bones is going to be the incisors and the incisor bones. So his incisor bones are going to be right here, and they will hold the incisors. So these are his upper incisors. Caudally to his upper incisors will be his canine tooth, and his premolars. There's 4 premolars here. They end with the carnasal molar, and then you have caudally to that the molars. The canine tooth all the way caudally to the molars are held in here by the maxilla. If we go ventrally to the upper portion of the mouth, we have the lower incisors and the lower incisor bones. Caudally to the incisors, again, we're going to have the lower canine tooth. Caudally to that will be the 4 lower molars, premolars, including the carnasal tooth right there, and caudally to that will be his molars. They're all going to be held in by his mandible. His mandible will run right along here. And then we're also going to have along the mandible the ramus, and we're going to have a vertical and a horizontal ramus, a vertical and a horizontal ramus. And the mandible here is going to meet with a temporal bone, which will create the temporal joint, or the TMJ joint. The temporal bone is going to run all the way up onto the top of his head here, and it is going to contain the external acoustic meatus, and that will have the ear bones. It will have the middle and lower ear bones. Towards caudally from the temporal bone will be the parietal bone, which will be right here, and then we'll have the occipital bone right here. And the occipital bone will have an occipital crest, and the foramen magnum will run into the occipital bone right here, and that will be where the spine meets the skull. We're also going to have the cervical vertebrae caudally to the occipital bone, and the first cervical vertebrae right here is going to be the atlas. So I can feel, if I turn Hunter here, I'm able to see a bit better, I can feel his atlas right here, and his atlas will have wings. So I can feel his wings of atlas right here. So caudal to that, where it will be his axis. That will be a second cervical vertebrae. And that is the summary of Hunter's skull.